hip dysplasia diagnosis process.
When diagnosing hip dysplasia in infants, the examiner is going to be looking at the clinical examination, putting it together with any ultrasound or x-ray findings, as well as looking at history of the child. So looking at whether or not there's a family history of the condition, whether or not they were breech, are they female, are they firstborn, and putting the picture together to decide where to from there. The ultrasound and the x-ray are looking at the shape of both the ball and the socket. So we're looking at the ball, which is the head of the femur or the thigh bone, and then you've got the socket, which is the part of the pelvis bone called the acetabulum. And so it's looking at the shape, it's looking at how well centered the ball is within the socket, it's looking so that coverage, so being the percentage that the ball is covered by the socket, and it's also looking at the angles formed between them, with the alpha angle one of the most commonly used angles when they're looking at guiding treatment. The ultrasound also looks at the looseness or the stability of the joint. So there is a range of angles which is considered normal in terms of the development of the hip joint, and that does vary as the child gets older and also looking at their gender. And when looking at the stability or the looseness as an infant, so in the newborn phase, they're looking at least a minimum of 50% of the ball remaining within the socket in terms of looking at the stability of the joint. Ultrasounds are used up to 4 to 6 months of age, and after that time then the x-ray becomes the preferred method for screening. Some specialists and DDH clinics will continue to use an ultrasound above and beyond this age, but if there's a child that's been flagged for potential hip dysplasia beyond 4 to 6 months of age, their community-based health provider needs to be referring them for an x-ray. And that's just something that I like to remind parents, because sometimes there is confusion in that space and it can further delay the commencement of treatment. At birth, 1 in 6 newborns present with some hip instability, and 1 in 500 newborns present with fully dislocated hips. Of those 1 in 6, the majority of them actually will spontaneously resolve, and 1 in 100 by the age of 6 weeks will require treatment for hip dysplasia. And this is why the recommendation for having a follow-up ultrasound, unless it's clinically indicated that the hips are dislocating or dislocatable earlier, this is why waiting till 6 weeks is the standard practice.